So go ahead and describe, said a little bit of neuropathy sensations in this right.
When I'm doing lateral raises,
Okay.
I can't feel my delt kick on in my right hand as much as my left hand. I am left hand dominant, and I feel like there's some asymmetry there, but that's the only movement that I feel that in.
Okay. But are you getting consistent nerve or numbness?
No.
Okay, all right. That's what I needed to clarify with that. Now, we had looked a little bit with Sandy, pre-movement on tape, pre-assessment, client standing and all that. Just the different positions we can put a client's body in and then observing how they're laying on the table, right? Now, right here, immediately, that right scapula is winged out substantially more. So it's tipped up like that. The right ones are what my muscle models are set up for, so that's helpful. So right off the bat, I know that's here. When that occurs, recognizing the muscles that cause that, so the bit of bony landmark reinforcement, and what we're palpating is we have the acromion, which is the big bony plateau you can feel, the spine of the scapula, and above that, supraspinatus, and below it, infraspinatus, all that good stuff. The superior angle, inferior angle, medial border, lateral border. Now, over here is the coracoid process, one that you pretty much will never palpate too directly. You may, and some smaller frame people, be able to actually make contact with this, but I don't try to because it would be painful. But this is what biceps, coracobrachialis, pectoralis minor all attach onto. And that's why if nerves are having to come out from your neck, over your ribs, and through this whole little channel down the arm, right here, this is what the nerves are doing. The pectoralis minor is right on top of that, okay? And when that shortens, it's gonna pull the scapula like this, along with levator scapula. Levator scapula is kind of where the shoulder shrugger, but both of them are gonna have a tendency to not just take the shoulder up and down like this, they bring it up and over around, and that inferior angle will be up, okay? But the prone position does lend itself really nicely to just sticking your hands on these scapulas and doing something that feels nice like massage, but then just paying attention to what are they doing. And there's a big difference from the right shoulder to the left. And although he's left-handed, left arm dominant, the right is reading more like what you would typically see in the dominant arm of people. Usually the dominant arm, the scapula is more elevated at the very least. And that'll be the thing that initially jumps out at you. If nothing else, make contact and whichever hand is further up. So here, I'm on the inferior angles, and that's what I'm seeing. So this hand, my left hand, his right scapula is further up. Now, I'm not going to spend a lot of time here. This is all long. What would ideally need to be strengthened? And you can feel there. And he understands all this. Is like a lower trapezius, mid and lower trapezius are what really pull the scapula down into depression. So that would be your strengthening. Try to pull everything down and to not just pinch your scapulas together, but to bring them seemingly down towards your pelvis is the goal. Now, from there, I can assess a lot of stuff, and I've assessed it's upwardly rotated, protracted. It's doing the thing that almost all shoulders love to do when they're dysfunctional. Now, if I bring the arms out to the side, this is my preferred position for working this whole area, predominantly just because it's safer. When we have a person at end range here, I can hit those, the nerve and artery more easily. The joint is more at end range. Like he's, I'm sure, fine, like he can contact all that good stuff. But if somebody has arthritis here, then they're going to be limited going into extension, hyperextension. If someone has really bad osteoarthritis, they might not be able to lay in this position at all. And you either are going to need to prop everything up here in the front so that shoulder is able to go into flexion, or ideally, they can at least go here and they're more comfortable. If I want to just do further assessment on table to just make sure, because the first thing all I care about, hard end feel and nerve pain. So if the arm can just come up over top of the table as well, right there is a screening process for me to know, well, the ball and socket joint is not too bad, and even as scapulas are at least able to allow for the arms to go above 90 degrees. And both flexion and abduction. So if I just position a person like that while I work here, that already was a big screening process for me. So that's where just in prone, put their arm in the 3 positions. Gives you a lot of good information. And it's passively doing a stretch. So I put the arm there while I work on all this. And latissimus dorsi is connected to that. So this leads to where I'm going to just show a lot of my personal hacks as to what has worked for me. A lot of this could both be done in prone and sideline. You got to pick the one that's best for you, right? So here, now, biomechanics wise, I might be getting a little low, so pay attention to this part of me more. Stabilizing the shoulder and all that stuff so that as you move, they're not just slipping where they shouldn't be. You're just, like anything, you're always safer if you stabilize the region prior to like working on it, right? Now, what I'm seeking to do, and I'll reinforce this over on this side, is that back here, you have 2 interesting triangles. Like there's the, the armpit, but on the front of it and the back of it, right? There's these big chunks of muscles that overlap. And there's especially back here on the posterior side of the shoulder, is a lot of layering. We have latissimus dorsi coming up and attaching of the humerus. We have deltoids sitting on top of all this. Teres minor and major going from the scapula over onto the humerus. You have infraspinatus coming over and feeding in. Now this is all deeper into rotator stuff, but that's feeding over, wrapping all the way around and attaching into essentially a shared tendon with subscapularis. It's just hugging the shoulder joint here. As well as triceps, the long head of the triceps. So talk about a crazy overlap, right? I find it difficult, when I'm being honest, to get a good amount of pressure into this area without the shoulder feeling like it's really hard to control in the sideline. So this orientation does allow me to come in and just try to be, don't try to be up in the actual armpit. Everybody here has been doing it long enough or is mindful enough to recognize that we're just watching out for that very medial line where that divides triceps and biceps, but where the main nerve and artery are coming through. So just be mindful that you're not dropping down too low like this. So we don't want to be here. I do want to be more posterior, kind of on an angle. I'm going to try to show most of this initially with a soft fist so you can kind of see, but then what I've always used is my forearm. All right. Now, here for lats, I can drop down on a knee or be seated on the stool and kind of pull latissimus dorsi away from serratus anterior. This would mimic in some ways what I showed in sideline, right? Where my forearm was planting and just pushing the scapula into retraction, right? This all could be done standing on the opposite side, if we're thinking just scapular mobilization. Just pulls like this, right? Now, it's going to be kind of pokey and ticklish on some people, but there's no reason why I couldn't, just like how we do here. This feels really good. Everybody loves this part. And this is usually the best thing for like your upper trap levator scap, aside from sideline. You're gonna do better work there for sideline. But in this position, this ends up being one, just a crowd favorite. But that same pull could be here for the scapula. Now it works better for him because we actually, with the muscle bulk, smaller frame people, it might get more pinchy or more ticklish. Okay?
Do you feel you're actually moving the scapula or the
Oh,
muscles over the top? Of the
No,
scapula?
no, no, it feels like, with him, I do have a hold of lat first, but the goal here would be that I'm hooking onto the bone and making it move, yep. Not over top. So my fingers are staying on the lateral border of the scapula and not slipping and going over top. So, and here, in his case, I'm able to be more specific and really grab a hold of lat and try to pry it away from serratus anterior. Now to get more direct, and this is more like the pleasant way to do this. Just mobilizing the scapula, you're best suited for this arm to be off the edge of the table, and then these pulls, it's a good way to change up how you're using your body anyway, because we're predominantly pushing. But just those in this position is a great way to get this slipping and sliding, generally. And that may be for a lot of people all you really need to do, and to just do that more on the affected side. To get more targeted at that crazy intersection, and this can be a place where some nerve impingement and trigger point phenomena can certainly occur. So where I want to be, and this is pretty impossible to miss as long as you muscle test for it, okay? The long head of the tricep will engage fully, but not until we're at full extension. Once he's to full extension, and you'll all feel this on each other, once you're fully locked up, elbow at end range, that attachment of tricep will really present itself. And then what's nice there is you just want to make sure you're pretty much right on top of that. And then you can either adjust to be more medial towards the scapula or come a little bit more lateral onto like just past the line of the glenohumeral joint. But any one of those, I feel like identifying the tricep attachment and then letting that guide you, because then you know you're on soft tissue, you know you're safe. And then if you just go towards the scapula and maybe down inferior a little bit, you'll be more on teres. If you come out a little bit more, well then it's certainly tricep. And there's certainly going to be some aspect of latissimus dorsi here that you're going to be getting all at once. Now the action that's been best for me, just because once we're here and we're covering so many muscles at once, what is a active movement component that's really easy for them to do that just gets a lot of these muscles to turn on and off? You know, super efficient MET. It's straighten the elbow completely out, which I'm already going to do to muscle test. Then rotation. Turn the hand over this way, turn the hand over this way, and then relax down. If I wanted to couple it in and bring in the antagonist contract, then I just say, okay, keep on curling your elbow, flex your elbow, and then push into the table a little bit. You're good, let go. Now the table gets to act as resistance for me there. And that does everything. Everything. I can apply inhibitory pressure, full extension, turn your arm over one way, turn your arm over the other way, come back to where we started, slowly let it back down. And that just worked really good almost all the time, when it seemed like this was more of the issue. So it's always a question, is it here, here, here? Is it all three? It's usually all three a little bit, but where is it mostly causing them problems, right? So all it tended to look like is this. I kind of slowly just rock my way. So all this will feel like massage, but all I'm trying to do is get my arm positioned where it feels like I'm set in that groove. Just lateral to the scapula, and I'm just rhythmically making it feel pretty as I'm just, I can glide my way up lat like this. But where my mindset is thinking about the scapula. So even right now, I'm going to lateral side of the scapula, and I'm just pushing it into retraction. Slowly working my way up. I know I'm already in the right place, but then I just muscle test. It's a nice, easy action for clients to do. This doesn't require them to use a lot of brain power or muscle power. They just gotta straighten their elbow up. Nice and slow, all the way. And I mean, it jumps out. Good, slowly relax, back down. Now, I'm a fan of encouraging, if the client wants like therapeutic results, there's specifically something going on here, then I'll ask a little bit, does it feel like it's more there, more here, more here? And I'm just making the tiniest little adjustments and pushing this way and asking them to tell me, does it feel like we're more on something important? This way, this way, this way, this way. And in real time, they can just give me that input. All right, so Ben, you tell me. More in that direction, here, down, any of it?
Nope.
So
It definitely changes the sensation though.
So there's that, but you just chase it. And you can do a little bit of all of it, but it also tells me, no, this is the unaffected side. Remember that, right? So run straighten the elbow, nice and easy. Now slow, slow, turn your arm over, one way, good. And then the other way. Great. See how my arm is positioned where it's naturally creating resistance, and then slowly let it back down. And then push into the table just a little bit, get those biceps going. And good, slowly relax. Done. Not hard to explain to them what to do, not hard on me. And then I can easily flow right into working more on the triceps proper. So here, I could plant my hand like this. If the edge of your table is kind of sharp, is the way to protect their arm from that table being smushed in. This table, I don't have to care about that as much. But this is the way I work on the triceps. And just a variety of angles with the grain, against the grain, with the grain. That's the short head. I don't want to belabor work. I mean, he could get a good massage here, but I got to make sure we're working. Forearms in this position works really good for the anterior side of the forearm. Remember that our common flexor and extensor attachments, where those are located. The common flexor attachments run medial. It's annoying because when people lay like this, they're pronated. So you turn them over. You can find those on yourself. So all the major flexors of your wrist and hands unify on the medial epicondyle. That's why golfer's elbow is called medial epicondylitis. Then all the extensors attach onto the lateral epicondyle. So tennis elbow is lateral epicondylitis. So to help that, well, we need to try to address that unified attachment site. In prone, it's really easy, and if I have a preference, like we could stand on this angle and all that, but here's my lazy, super efficient way. Not this forearm, but this one. So I'm right there, there's the epicondyle, and just inferior to it. Now I wouldn't do this if my goal was venous blood return and lymphatic drainage, right? I would do this for, seems like there's muscle tone issues or tendonitis. And since that lateral and medial epicondylitis is so common, this is a way to just get a really good pressure. I am going a little downhill, I can't have too much lotion. Then once here, we can play with every action we could think of with the hand, okay? And so through this whole range, and I'll balance them out a little bit, and you just want to be thorough here. Remember, you can be here, you can go right down the middle line of it, but you have stuff on either side as well. So people with forearm related issues, fellow massage therapists, it doesn't matter. I'm just doing little things like I'm tilting my forearm this way and this way to make sure I'm more on the medial side, more on the lateral side, and more central. I know it sounds like I flipped that, but I didn't, because this would be anatomical position. All right? Once here, and you just divide the forearm in half. This half, the proximal half, tons of muscle bulk on both sides. You're very well protected from squishing any tubes you wouldn't want to. The lower half, very tendinous. Direct pressure down here, you should be not doing. Okay? These do good with going side to side. Go across the green and get this all slipping and sliding. That's pretty much all you need to worry about is here don't apply a lot of downward pressure. But go across it. That's where kneading will work just spectacular by the wrist. But even with carpal tunnel, we can work here and what have you, but a lot of times a symptom manifests at the wrist. It starts affecting the muscles of the forearm, and where we can actually be more beneficial here, where this is all tendinous, is by reducing the tone up here. So even when it's carpal tunnel, tended to do a lot of the same things up here on this proximal half of the forearm. And once here, wherever it happened to be, especially if I found something, then the actions that you ask the person to do for muscle energy are pretty simple. It can be make a fist, open the hand. Okay, it can be touch your thumb to your pinky and then all your other individual all your individual fingers. It can be just wiggle them all around. It can be tilt your hand to the outside, to the inside, you know, like the Queen's wave, all that kind of stuff. But really what I tended to do was fist, circles, open hand, circles, wiggle everything around, play the piano. And that covers pretty much everything. So through this whole stretch, it would be all right. Wait, come in. I tended to support under the elbow like this. Come with a big old good squash. And say, okay, make a nice strong fist, nice and slow, hold it. Like anything, ideally we would be doing these holds for longer, closer to 10 seconds. Right? That's what the research supports. And then this is a big one. I strongly encourage you to tell people just to control the deacceleration, to control the release. So slow things down. So slowly let go. Slowly, and then slowly go to opening the hand up. Great. And let go, nice and easy. Don't hold the pressure here too aggressively for too long. You might cut off a little circulation if you're applying a lot of pressure. But then here it could be make a fist, roll everything in a circle, roll the wrist in a circle. So we're having combined actions of the flexors plus the radial and ulnar deviators, a little bit of pronation, supination, then open the hand up. Same thing, roll in circles. And good, relax, and play the piano. And the goal here predominantly, because of how overlapped and just really matted together all the muscles of the forearm are, is to get them all unstuck. So as I'm applying this pressure and having to mobilize all those, and we're getting a lot of internal friction. Beyond that, some really thorough kneading goes a long way. What can get lost is like what to do for pronation, supination. If a person's shoulder can do it, this can be really valuable. But some people, they're not going to necessarily have that mobility, all right? But when you can, this is kind of a cool element where we're getting a combined action of encouraging supination, which is usually what they need more of. People get stuck in pronation, but we're getting external rotation, lateral rotation of the shoulder at the same time. So when the arm is the focus, see how if I stand here, I go in this direction, I'm getting a little external rotation and supination just by gently. No hard end feel, no nerve zing. I could be sitting down. And look at that shoulder, just rhythmically being taken in and out of rotation. Then I want to be more aggressive. Right there, supinator and pronator on the other side are problematic muscles. But this allows me to get a really good application there. I would still save some time and do the rest of this in supine. But sprinkling this in and prone, because of how I get that coupled rotation of the shoulder, I think is a really nice thing. So, there's that. With any of these two, if we were getting real specific, just give them a handshake. You can come in. Doesn't matter if you're doing fingertip or whatever it is. And then you could say, just hold your hand still. Just hold it still, don't let me move you. And I'm activating pronation, supination by just trying to turn the hand back and forth that way. Or I can tell them to do that. All right, so not too bad here. I would think probably the most novel thing for everybody would be turn the arm over and here. So in real time, just sprinkle that in real quick over on this side. Quick thing with the idea of working in this area, the upper trap levator scap, kind of that, just everything between the scapula and spine stuff, is if I use this forearm, my pressure is going to be focused a bit more towards the spine, because that's where my elbow is closest, okay? And I'm finding stuff, he's got some ropey moments in there for sure. But if I switch my arms, and look, I'm not standing here, right? I'm standing on this side of the head, and a little bit almost over on the other side of the head. If I do the same thing, now that is going to be more targeted along the line of the scapula. So just by switching the arms and doing the same series of applications, then I'm going to be getting different aspects of the muscles and soft tissue relative to the scapula. And it'll feel different for them. He's finding stuff, he's moving.
Yep.
Are you on?
Probably this feels like it's for real rhomboids. And he probably is actually strengthening and trying to keep rhomboids in check, so. But then he knows what he's doing. I could just pin this and say, okay, go and activate. You got an athlete that actually knows the actions. They're like, yeah, do some scapular retraction. There you go. So that goes a long way. This arm as well as this arm. Both will naturally guide you to be a bit more focused on these structures.
So you're still in between the shoulder blades?
Yep, both those. I'm just on angles. This one by the spine, this one by the scapula.
I'm using my left arm versus my right.
The non-dominant arm is always a challenge with that. So, now it's gonna be harder for you to see, but I'm just replicating what I did over there, more as a kindness of anything else. So then as I come through, then through palpation and everything else, I'm just checking and seeing, do I feel a tonal difference? It is different. How about you, sensation-wise?
It feels less on this side.
Well, that's interesting, isn't it?
Because that was the side he was.
This is the side that he said was seemingly more symptomatic, but he's left-handed. We're going to straighten the elbow. Good. Go ahead and turn the arm over. Good. Turn the arm over. And good. Relax. Nice and easy. Pushing the table. Get the biceps to flex. And good. Let go. And I'm able to kind of smoothly just, right there in real time. If there's nothing going on, then I can just move on. My first introduction to really having to be more thorough with arms, aside from fellow massage therapists who are using their hands too much, or cosmetologists, dental hygienists, all that good stuff, were bodybuilders. They were coming in and they had a couple guys with the bicep tendon ruptures and stuff like that. And so I had to be really thorough through this area. And it was a good teaching moment for me, working with them. So when we get to supine, that'll lend itself. So here, your thing, just come over. I've warmed the area up with a few nice glides and all that good stuff. And then I would just go right into the more targeted pressure. I've warmed up that superficial layer. And then make a fist, roll on a circle. Good. Slowly, slowly let go. Open hand up, roll in a circle. Excellent, and play piano. And I just slow all that down and be a little bit more thorough as I slowly glide my way down the forearm. Good, relax. That and what I miss, because usually I couple this in. This is like the final thing I do are these pulls. And we could incorporate scapular movement with this. I kind of find a good spot and say, all right, like real slow, roll your shoulder blade around. Good, and relax. And then just remembering that we can do that same action and pull on this side. For him, I'm gonna move arm up. Now, is that too pokey?
Nope.
Do check in with people when you're in their armpits. You're not. It's really easy to catch a skin fold. It doesn't matter what body type we're talking about. It's like you got to be cautious with the sensitivity of the skin in this area. And where I tend to defer to going over clothing or over the sheet, just because it tends to be less scratchy and less pinchy. So, there is that.